Welcome to the Health Practice Update. My name's Anthony Lowe. I'm Chief Executive at TAD and a member of the Institute's Public Policy Council Committee. I'm standing in for Stuart Roger, a member of the Health Practice Committee, who unfortunately isn't able to join us today.
And I am Brent Walker. I'm a consultant actuary. I've worked in health for about 45 years and I set up the original Health Practice Committee back in about 1978.
In this update, we'll talk about the recent private health insurance reforms, APRA reforms to the appointed actuary standard, what's happening in the wider health arena, sources of health-related CPD, and how you can get involved. There's been a great deal of public debate recently about the value and affordability of private health insurance, particularly around premium increases, the difficulty for consumers in understanding what is and isn't covered by their policies, and out-of-pocket expenses. In October last year, Minister Greg Hunt announced reforms which are designed to make private health insurance more transparent and affordable. Arguably, they're the biggest shake-up to private health insurance in 18 years. However, many of these reforms actually won't take effect until April next year. The reform that's received the most publicity is characterising hospital insurance products as gold, silver, bronze and basic, and implementing standardised clinical categories so that it's clear what is and isn't covered. For example, a gold product must cover joint replacements on an unrestricted basis, but silver and below needn't provide this cover. Other reforms include reducing costs for consumers through a $1.1 billion reduction in prosthesis benefits. These reductions are expected to lead to reduced premium increases. Private health insurers have stated that every $200 million in prosthesis benefits reduction will reduce private health insurance premiums by 1%. Requiring insurers to allow policyholders with insurance that does not offer full cover for mental health treatment to upgrade their cover and access mental health services without a waiting period on a one-off basis. Allowing insurers to discount hospital insurance premiums for 18 to 29-year-olds by up to 10%, with the discount gradually phasing out after people turn 41, allowing insurers to expand hospital insurance cover to travel and accommodation benefits for people living in rural and regional Australia, and increasing the maximum voluntary excess from $500 to $750 for singles and $1,000 to $1,500 for couples and families. Further, Minister Hunt established a Ministerial Advisory Committee chaired by the Australian Government Chief Medical Officer, Professor Brendan Murphy, which is looking into out-of-pocket costs. A full list of the reforms can be found on the Department of Health website. Actuaries Institutes recently commissioned Ernst & Young to develop a private health insurance green paper, which will look at issues of sustainability and intergenerational equity. One of the questions Ernst & Young will be looking at is whether the recent reforms, when fully implemented, will be sufficient to maintain the place of private health insurance within the Australian health system, or whether further reforms will be necessary. The Green Paper is expected to be published early next year.
In June, APRA released a package of measures to clarify and strengthen the role of appointed actuaries. These cover general, life and private health insurers and include a new cross-practice prudential standard, CPS 320, which harmonises the requirements and expectations of appointed actuaries across all three insurance sectors. In response to industry requests, APRA extended the implementation time for the new standards until the 1st of July 2019. Mental health continues to receive significant attention with the Productivity Commission inquiry into the role of mental health in the community and the best ways to support and improve national mental well-being. This will be an important area for health actuaries to contribute. Health continues to be highly political, and we can expect private health insurance and health in general to remain in the news in the run-up to the next election. The Labor Party has announced that if elected, they would cap private health premiums for 2 years and asked the Productivity Commission to undertake a wider review of the sector.
Actuaries Institute has some great sources of health-related CPD, including the Future of Health seminar, which this year was held in Sydney in October, the Private Health Insurance e-learning course, which can be found under Professional Development and Regulation after logging onto the Institute's website, green papers, including Who Will Fund Our Health and Mental Health Insurance, the dialogue, including Private Health Insurance Billshock, What Can Insurers Do to Help, and many excellent Actuaries digital articles on health-related topics.
We warmly encourage actuaries working in health to get involved by contacting a member of the Health Practice Committee. Our committee is a small but highly active and supportive practice area. Actuaries are in a unique position with the skills, knowledge and credibility to provide informed commentary on health policy. Thank you all to the members of the Health Practice Committee, past and present. Your generosity in giving your time is much appreciated and tremendously valued.
And thank you for watching this Health Practice Update.